All right, good afternoon, everyone, and welcome to FWMD Live. And today we are having a conversation about a COVID-19 research group formed by the TCU and UNT School of Medicine, along with physicians from many of the well-known physician and research groups right here in North Texas. Now, I'm your host, Prescott Stokes III. I'm the Integrated Content and Marketing Manager here at the School of Medicine. And today I am very happy to be here with our founding dean, Stuart Flynn.
Thank you very much, Prescott, and welcome everybody. Look forward to the conversation.
All right. Thank you, Dean Flynn. And like I said, he is the founding dean of the School of Medicine and also a pathologist and a cancer researcher. Also, I am happy to have another one of our esteemed colleagues with us today, Dr. Mohana Krishnan Satyamurthy.
Hi, Prescott. Thanks for having us. I'm really also looking forward to a really stimulating conversation today with everyone.
All right, Dr. Satyamurthy, or Dr. Mo, as we all like to call him, and his patients in Fort Worth, is the Department Chair of Internal Medicine here at the School of Medicine. And also, he has served in a number of leadership roles with Baylor Scott and White Health System, including the immediate past Chief of Staff at Baylor Scott and White All Saints. And he also serves as the founding medical director for the Baylor Heart and Vascular Hospital here in Fort Worth. Now, our experts will answer any questions you have about their research efforts around COVID-19. All you need to do to be a part of this conversation is jump into the comments, leave your question. I will definitely get you some answers. But before we get to your questions, I'm going to begin with Dr. Mo. Dr. Mo, there are 3 things this COVID-19 research group plans to study. Can you tell us what they are and why you all chose to study them?
Yeah, so very briefly, 3 major areas that we saw as opportunities to investigate in this devastating pandemic in trying to improve outcomes for patients based on our observation of the biggest challenges we were seeing in hospitalized COVID patients across the city of Fort Worth, and then in communication with our peers from around the world, are the following 3 areas. Number 1, thinking about repurposing existing therapeutics to treat the out of control immune response that we're seeing in COVID-19 patients that get very sick. The second is treating patients that suffer from blood clotting events that we're seeing increasingly prevalent in COVID-19 patients. And then the third is collecting samples, clinical data, et cetera, from patients hospitalized with COVID-19 and forming a virus repository so that we have the opportunity to sample this database over time and ask those exceedingly important questions that need to be asked that we might not even know how to ask today here in 2020, but with tools and study, be able to ask those intelligent questions down the road. And so that's the 3 principal things that we're studying with this group.
All right. Now, I heard that you have named the group, the research team, the Fort Worth Clinical Sciences Working Group. That's their official name. And I just want to know how many physicians are in this group and which North Texas hospital and research entities represent.
Yeah, so we came together, and certainly when this pandemic occurred, it really it dawned upon me to really think hard about how we could organize an exceptionally talented and diverse group of clinician scientists from around the city of Fort Worth and frankly the region to work together in a highly collaborative fashion to try to offer our hypothesis-driven protocols, which we just discussed, these 3 areas that we're interested in studying, to tackle this. So in essence, this is a group that was brought together in a voluntary fashion to work on these vexing problems, and we've been able to accomplish that. We have colleagues that are recruited across all of our major hospital systems here in Fort Worth. We have a couple of our colleagues from Baylor in Dallas, Baylor here in Fort Worth, Harris Hospital, JPS, among others, and Cook's Children's, of course. And then representing various different specialties and all the specialties that essentially play a critical role in the management of the sickest COVID patients. These would include infectious diseases, immunology colleagues, cardiovascular colleagues, folks that are in pediatric medicine, and of course, critical care and pulmonary medicine. So we've really got a very diverse pool physicians. All of these colleagues also have a background in science and investigation that helps create the right type of group of people to move forward in this type of intense collaboration.
And that's great that you have such a wide range of physicians and some of the top specialty physicians in our area as a part of this group. Dean Flynn, you've spent your medical career as a physician, as a researcher, and also as a leader in medical education. So in your own thoughts and opinion, why was it important to have the School of Medicine critically support this effort?
Well, thanks, Prescott. Let me just start with a statistical observation. So about 85% of discoveries in medicine occur within a 20 or 25 mile radius of an academic medical center, grounded around a medical school. So that, I think, I would say very humbly, is a major purpose for this medical school. The second component, which is going to echo back on what Mo just said, is our school is not set up to have some who are with us and some who aren't with us. We are a distributed model medical school, which means we value the relationships not only with all of our institutions in Tarrant County, but we are definitely branched out. We're over in Dallas County, maybe the chagrin of Dallas a little bit. But part of that then means we can now capture very, very collaboratively, as Mo just said, expertise from all of these entities. The value of this at the very outset is our students and our community, and soon residents, will see the value of this inquiry kind of based model to, it's not just practicing medicine and listening through your stethoscope, it's asking questions. So Mo is being humble, but he is the individual who started this. This was a big inquiry, and then he started bringing us all together. That's the initial role of this medical school: capture the excellence in this community and harness it to do things such as this study. And then lastly, downstream, this will attract like-minded individuals into Tarrant County, into Fort Worth, into our medical school. And then lastly, it will attract industry. And these are all big victories. So I would say, I hope the medical school has played at least a little role in kind of setting up the environment for this to now what is playing out in a very robust fashion.
And, you know, I chatted with both of you guys off camera, and we just talked about the importance of having a dean of a medical school actually be a part of this working group. You guys have had since March close to 30 meetings via Zoom. And I just want to know, Dr. Mo, how important is it that Dean Flynn actually showed up to pretty much every single meeting that you all have had so far? What does that kind of support show to the other physicians that are participating?
Well, I'll tell you.
Be nice, Mo.
I'll tell you, really, and we've been very honest about this within the working groups. Remember, this is voluntary. It's not required. Everyone is working hard to care for patients, have their very important lives outside of their professional obligations. And so every physician colleague has donated their time to this effort out of a deep desire to help us accomplish this mission, which is to help save lives, to help bring talented folks together to solve vexing problems in this very challenging disease state. Now, when the leader of our institution is not only willing to participate in name, just the fact that the dean is willing to be a part of our working group is an incredible honor. But for Stuart to actually take the actual time and be in attendance at really close to every single meeting we've had, and these are hour to hour and a half long, peer-driven, scientific, rigorous sessions, essentially reviewing all of our progress to date, thinking through our hypotheses, looking at the evidence, designing studies, I mean, down to the most granular possible details. And for the dean to participate says an incredible amount about his commitment to all of us as his colleagues at the school, as his charges at the school. It inspires us. I have a close relationship with the dean because of our administrative work together, in the school. However, many of our colleagues are meeting the dean for the first time and have created a really incredible personal relationship. And so when someone in his position is willing to actually give the real tactile time and effort and be a part of the conversation, be a part of the solution, that motivates everyone. And frankly, this is something that I think is very rare. And I would be challenged to find another circumstance where someone in his role and position is willing to devote this type of time to this type of ground up effort. It's remarkable.
And I want to let everyone know, today we are having a conversation on FWMD Live about a new COVID-19 research group that has been organized by the TCU and UNT-HSC School of Medicine. If you have any questions about COVID-19 or that research, just jump into the comments, leave your question, and then I will have Dr. Moe and Dean Flynn get you some answers to any of your questions. What I want to do is just talk a little bit about COVID-19 now. We've heard a lot in the news about how COVID-19 has disproportionately affected Black and Latino communities. Dean Flynn, can you just tell us, how does understanding genetics help guide the aspects of this research that you all are doing right now?
Yeah, so again, thanks, Prescott. That's a very profound and insightful question, quite frankly. The answer I will start with, and then I'll just share a couple comments from the genetics and its role in whether a patient becomes symptomatic, whether a patient becomes very sick, potentially dies, and then the impact on people of color. The answer is we don't know. And now I just want to say why we don't know. This is a brand new virus. We've now seen it for about 6 months. So what you know about COVID as a non-physician is substantively close to what we in the medical community, and it's because there's no textbooks. You can go read about it. We're building this literature live. So my guess is that we will find genetic fingerprints that will look different for patients regardless of race who get really sick versus those, same virus, who maybe get a cough and a little bit of a fever. Do I think it's the only reason? I don't. But do I think it's part of a key to unlock what we understand? I do. Last thing I would say is, if you look at diseases that we have studied, and then you start to realize the genetic component is the major driver. In sickle cell anemia is a very simple one, right? We didn't need fancy genetics to know that was in the African American and the Black world population. But there are other things much more subtle that as we do the genetic studies, we start to realize, oh, they're at risk because of this genetic profile. That's one of the things we are very much hoping to start to build our knowledge base and discover these. And then if we discover different patterns, now the next trick is, okay, you've discovered it, how do you intervene? And so you can see that's the road you get on, discover, but then keep that patient from getting very sick if that's what they're prone to do. Mo, I don't know if you want to add anything to that.
Yeah, I would echo the dean's sentiment. Certainly from an investigational standpoint, as scientists, we are deeply interested in trying to unravel and help others from around the world. I mean, these efforts are ongoing everywhere, and we're doing it right here in Fort Worth with biorepository that we're collecting. This will be a genomic database of patient samples, if you will, to help us really start unraveling these very important questions. So one is existing differences, and though we all look the same, internally we may have differences in terms of what our program is like, and that may in fact affect the way in which the body mounts an immune response. So that's I certainly agree. And the second piece is also very important, and this is something that we talk about quite a bit in the medical school, and that's access to resources and health disparities. And does every segment and every member of our population have an opportunity to access care at the critical time points necessary to stave off any disease, whether it's COVID-19 or diabetes or heart disease, cardiovascular disease. This is critically important. And so I think it's probably a combination of both.
And I just want to let you guys know that we did have a question come in while you are were talking, and I want to thank Lori. Thank you, Lori, for your question. And her question is something that we were actually going to get to in this conversation, but we can just get to it right now. So she wants to know, how do you both feel about the vaccine for COVID-19 that is starting to be administered? And Dean Flynn, I'll start with you. You can give your thoughts.
I was hoping you would start with Mo, and then I'd say I agree. So, this is the first time in my career, and I find this very sad, that we've had so much flack shot up in the air that even those of us in the field don't know what to believe and what not to believe anymore. That's just phenomenally sad to me, from the FDA perspective, from the CDC perspective. And I would just say parenthetically, if you look at the CDC historically, it's their weekly newsletter that came out in the early 80s that identified 5, I believe they were gay men, who had this odd infection that we had never seen other than in acute leukemics. That was the first report that came out of our CDC, the first report for AIDS. And now move the clock forward 40 years, and you don't know what to believe anymore. So to answer your question, if I'm going to make it personal, what do I have to trust? I have to trust the companies making these vaccines are being transparent in reporting not the successes of their trials, but the side effects. And they're often very rare, very unusual, very uncommon. But one of the trials shut down a couple weeks ago due to inflammation of the spinal cord. Well, that was one patient, but those are the things you want to know. So for me to allow somebody in my family now to get a vaccine, I will be very cautious. I'm going to pay close attention to where that information is coming from. Unfortunately, I'm not convinced I'm going to believe the CDC or the FDA right now, because I think they've just been perturbed too much and being told what to say. And amazingly enough, I'm going to have to put a fair amount of stock on Johnson & Johnson and these other companies making these vaccines. And if they're willing to put their name on them and say they've done the trials, that's at least getting me close enough to start to believe that at least they're safe. And then the other part we're going to have to study over the next 6, 12, 18, 24 months is, does the vaccine actually generate an immunologic protective response? And if it does, how long does that response last? I have to say, this is just amazingly disappointing to me in my career, to not be able to trust your CDC and to trust your FDA because it's been politicized. Mo, you're welcome to tamp that down a little bit if you want.
Well, if I could maybe take it from a scientific perspective in terms of focusing a very special and intense light on the intense effort and, frankly, the pace of discovery and drivetrain of science that's never been witnessed in medicine. So for our audience joining us, as you've probably read in the press, vaccines typically, if things really go smoothly, can take a decade to come to fruition. Oftentimes, it's a much longer process than this. It's an exceedingly tedious and challenging process. And as I like to describe to my colleagues here in the community, what's happened is, because the entire world has worked on this, governments have worked on this, so many of our leading vaccine research programs across the world, universities, corporate, et cetera, the pace of discovery to hammer out the science necessary has been compressed from all those many years down to now 6 months, which again, this in and of itself deserves a Nobel Prize, frankly, to everyone involved, in my view, because it's never been accomplished before. So that type of speed to discovery of truly capable therapeutics for this particular vaccine is important. Now, the other side of this is also the deployment of this in healthy volunteers to determine, do we have an acceptable safety profile? Do we have an acceptable efficacy profile? And again, because the whole world is interested in a positive outcome, we've got massive opportunities to enroll massive numbers of patients to accomplish the endpoint. But it's critically important that science that science is given the time necessary to deliver the outcomes necessary based on the numbers of folks that need to be enrolled, because otherwise it leaves us always wondering the two key questions in medicine, whether it's vaccine development or therapeutic development: is it safe? Is it effective? And you've just got to let time declare this. And I would emphasize to anyone listening, that time frame has been shortened to essentially a world record pace, but it still takes time. And we just simply can't rush a process and a time frame that's already about as compressed as one could possibly fathom.
Prescott, if I can just add very quickly, this is a personal comment. I'm not developing the vaccines, but I personally think it will be summer to fall of 2021 before there's a vaccine that society can start to believe has been duly tested and is safe. And the second thing I would say, I'm not sure I heard it correctly, but Mo may have nominated all of us for a Nobel Prize.
We haven't been involved in vaccine work at all. So
never mind. Just nominate me.
All around the world are working on it. It's that stunning of a process, and all these folks really deserve incredible praise, because I'm just amazed at what they've been able to accomplish.
Agreed.
And Dean Flynn and Dr. Mo, so we got quite a few questions as you all elaborated on that discussion around the vaccine for COVID-19. Just want to let everybody know, if you do have a question today on FWMD Live, we are talking about a COVID-19 research group that has been organized by the TCU and UNT-HSC School of Medicine. And we have our founding dean, Stuart Flynn, and we have our department chair of internal medicine, Dr. Satyamurthy, with us. You can ask them any questions about COVID-19 and their research. Just get in the comments, leave your question, and I will get you some answers. So one of the first questions that came in while you all were talking before, one person wants to know who owns the working group's research, and is the working group underneath TCU or UNT-HSC? Dr. Satyamurthy, I know this is your baby, this research group, so I'll let you go ahead and answer those two questions.
Yeah, that's a really prescient, excellent question. It gets into something that we talk a lot about in the group, which is intellectual property and our ideas and kind of preservation of all this work that we've put into this process. So to begin with, the Fort Worth Clinical Sciences Working Group is an independent entity. We came together as a group of clinician scientists with a charge that formulated probably, Stuart, now 6 months ago, 5 months ago, something like that. And so it turns out, very conveniently and very importantly, in fact, all of us have faculty appointments or affiliations with the TCU and UNT Health Sciences Center School of Medicine. And we've done it essentially in the Fort Worth way, which I know the mayor would be proud of, and certainly all of our friends in government here in the city. We are a can-do community. We are a city of collaborators. We just get things done. And we have a spirit of cooperation that's unique and novel, frankly, in comparison to any place I've been. And thankfully, I've had the experience of being in great collaborative environments. And so I could only think of this town where you could bring together such a diverse group of folks, have a dean of a school of medicine, support the project at the level that I demonstrated that he's supported us, and do so in a boundaryless environment with no egos and just simply a desire to succeed. So the working group is an entity that actually owns the intellectual property for this. It has a direct affiliation with the medical school, and obviously everyone has their own independent professional and career affiliations. We're just sort of that amalgamation, if you will. And so that's my answer to that. Very good question.
All right, thank you for that, Dr. Mo. We also had another question that came in just about COVID-19, and this question is from Cindy. One of her questions is, what causes the wide array of symptoms and prognosis in different COVID-19 patients. Dr. Mo, is that something you can elaborate on just a little bit?
Yeah, so several things, and I think Dr. Flynn already touched on a key component, which we're all so deeply interested in, as are other physician investigators and scientists around the world, and that's the underlying genetic makeup of an individual that may absolutely determine the expression of disease in that individual. So that's one definite answer, and that's a to be determined discovered concept. The other, of course, is the intensity of the viral load that's delivered to an individual to start with, and then how that individual's immune system responds to that viral load. So sort of innate characteristics, if you will, that are related to the infectious burden of a patient that undergoes the illness. And then the third is the time to presentation of an individual. I really want to emphasize this to all our viewers. You know, and we've talked about this many times over the years in cardiovascular disease topics in various media discussions. And that's that if you feel like something's not right and you feel like there's a risk, seek professional medical advice and counseling and evaluation. Don't delay, because the longer you wait in this process, the more likely you are to start suffering from potential more severe consequences of this. So if you give us an opportunity to catch this in the early phase of disease manifestation, we have therapeutics that have evolved over the past 6 months that are reducing the morbidity and mortality that's associated with this devastating illness. And then we have therapeutics that, for instance, our group is working on, that other groups around the world are working on. And we so hope that in the coming months, as more of these therapeutics are validated, we can really prevent death, you know, in this catastrophe.
And Dr. Mo, there's another thing I want you to touch on that's actually a big part of the research that you all are doing, and it's this idea of inflammation. So we've heard so many patients and news stories of people talking about they can't breathe when they get COVID-19. It's really, really hard to breathe. They go into the hospital, they get checked. There's an unimaginable amount of inflammation, right? Can you talk about the science behind that inflammation and why you all are actually looking into that in the research group?
Yeah, that's a great question, and boy, is it a topic of great interest, both in the general public and certainly in the scientific community. So if I were to take something that is too complex to describe, it's probably contained within multiple textbooks, and try to simplify it. This is the way to think about this. Dr. Flynn mentioned that this is a novel virus. So the moment this virus gains entry to the body, we have a hierarchically evolved immune system that starts identifying the space invader and then starts getting after it very, very thematically in a very sequential fashion. And so it's almost like an orchestra, right? You identify, you know, the soloist, which is the virus, and then the orchestra starts to perform. And so that then all these cells start attacking this foreign invader. And they start secreting compounds that recruit more cells that then secrete other compounds that lead to sort of this building of a fire within called the cytokine storm. And then that leads to damage of lung tissue, of cardiac tissue, of vascular tissue, allows for leakage of water that's well contained within your vascular system into the lung space. Now, Dr. Flynn made another important point. You know, we only know so much about this, and this so much is already a ton, but it's going to keep expanding. So there are other hypotheses that are evolving just in the past month that are related to completely different pathways that have nothing to do with cytokines, that have to do with compounds that have a impact on vascular reactivity, a compound called bradykinin, and several other pathways. So we think it's probably going to be a huge combination of these various pathways that's leading to these very, very dangerous endpoints.
And Dr. Mo, we had another question that came in. Thank you for your questions for everyone that's watching. We're talking about a COVID-19 research group being put together by the TCU and UNC HSC School of Medicine. Question that came in is about a virus repository. They want to know what that is and what it does.
So I'll probably just editorially fix that. So it's if for some reason I wasn't clear in terms of my enunciation. Biorepository, so not a viral repository, but a biorepository. And so that's just a collection of samples. And the samples would be blood, which contains a component called plasma, in which we can measure these cytokines, these inflammatory mediators, and then of course cells. And so from cells, we're able to extract, all of the genetic components, the genomic components, DNA, RNA, et cetera, and then do sequencing analysis, et cetera. And so the biorepository is a part of this prospective group of studies that we're going to be launching in the city of Fort Worth. And of course, everything is with our patients' consent and fully informed consent to participate in a study like this. The samples are going to be stored under the aegis of the working group and be available for members of the working group. And frankly, our vision is to be able to share this with any potential investigator from anywhere who would be willing to collaborate with us on discovery.
And Dr. Mo, one other thing I want you to talk about with the research before we move on is about repurposing these already available off-the-shelf treatments to better treat COVID-19. Can you just explain how that works? Is it something like a treatment that's already available and changing the dosage, or making them work in some sort of combination? Can you explain how that works?
Yeah, and so this really came from, again, I mentioned to you, and I hope this made sense and it explained a very complex topic at a 90,000 foot view. But when your immune system does its job in trying to attack this terrible virus and try to clear it from the circulation, it's producing all these cytokines. Well, we've investigated this and we see what those cytokine signals are. And our group had hypotheses. So this is very important, particularly for the young listeners in the audience that are interested in science. The scientific method is a glorious method, and it really involves asking a key question based on a hypothesis. And so all of our efforts are hypothesis driven. They are based on an understanding of immunology, of the immune response to a novel pathogen, understanding what those pathways are, validating those hypotheses through real careful research and review of the literature, and then asking the question, well, do we have compounds that exist? Because we don't have the bandwidth or capability to produce, for instance, a monoclonal antibody directed to a very specific cytokine in the kind of time that's necessary to help patients today. I sure hope that we'll be able to do that 10, 15 years from now. But right now, what we have to do is identify those targets and then ask the question, is there something available in the commercial space today that we can grab off the shelf and use as a therapeutic? And the answer is yes. And we have therapeutics that are actually available to us that actually fit within our hypotheses. And that's what we've essentially been spending all this time doing, is preparing these protocols, preparing these studies to test our hypotheses using these agents.
All right. I just want to let everyone know, if you're just joining us right now, we're having a conversation about a COVID-19 research group that is being put together by the TCU and UNT-HSC School of Medicine. I have our founding dean, Stuart Flynn, with us, and I also have our department chair of internal medicine, Dr. Satyamurthy, with us to talk about it. And now I want to talk about medical students. Dean Flynn, can you just kind of explain to us what advantages does this give medical students that this research effort is being organized by the medical school?
So first of all, it places our students in an environment of their faculty and their community being inquisitive. Instead of just accepting what others tell us, we want to answer our own questions. That's what this group is doing. We could wait for Boston to answer this. We could wait for Palo Alto to answer this, but we're not. Secondly, as some of you know, every one of our students has to do a 4-year research thesis, mandatory for graduation. This is the environment they're training in. If we weren't doing any research, it seems paradoxical that we'd be asking them to do it, but then nobody at their school is doing it. So that's the ecosystem, the environment for our students. And I would say, and I was going to say it earlier, cytokines didn't exist when Mo went to medical school. Well, they existed, but Mo, and I'm joking because Mo heard about a few cytokines. But people not in medicine, just to say what a cytokine is, it's produced often by inflammatory cells to attract other inflammatory cells. So they're calling other cells into the war, into the fight. So now we know more and more and more about cytokines. But if you say cytokines to physicians, we just start to shake because we know they exist. We don't have them put to memory unless it's our field or unless we're using a therapy for them. And the only thing I wanted to say about the cytokine storm is if you go out and scrape your knee today, your body will make cytokines to heal that, and you'll never know it. You'll just know you healed. The problem with a cytokine storm is some patients overshoot that runway. So the same chemicals that should have helped you clear the virus and get healthy again, and that may be what's happening in the patients who just, get a small fever and then they get better and they're COVID positive. But when it overshoots the runway, you just have, and I think it's aptly named, you have a storm of cytokines that are doing much more damage now than why they should have been there in the first place, which was to clear the virus. But to answer your question again, this is exactly the environment medical students should be in, where their faculty are asking tough questions and trying to push discovery for the future of medicine.
And Dean Flynn, we had a question come in from Neil Smith. Thank you for your question, Neil. The question is, what preventative health measures can be recommended for people with COPD, bronchitis, asthma, besides the flu shot to keep lungs healthy during the pandemic and also during flu season because it is flu season? From a medical standpoint, can you, Dr. Mo, provide any advice about that?
Well, I think probably Mo is better placed, so I'll steal all the easy ones, and then I'll let Mo kind of fine tune. I actually think it's one of the rare times, because it's been so out front day in and day out. It's a great question. So the flu shot is absolutely, there's the first thing you do. The second thing is all we have to offer right now, and that is the social distancing, wearing a mask, just being highly preventative of putting yourself into an environment where you run the risk of getting infected. And that's why there's such a push to get a vaccine for COVID, because then, like the flu vaccine, we get the flu vaccine and we go shopping and we go out to eat and the like in the olden days, and you thought you were protected. You aren't always, but for the most part, many people were. Mo, do you want to put a fine tune on that, since you have patients coming into your office every day with some of these diseases?
Yeah, no, I would just say that, Stuart just hit the hammer on the nail. I mean, that's absolutely correct. All these measures are critically important, particularly when you have a susceptibility in the lungs. I would add some value by asking anyone with chronic lung conditions to please, it's such an incredibly important time to be hypervigilant about compliance with the medications that your physicians are prescribing for your lungs. So those are your inhaled steroids, all your inhaler therapies, whatever your physicians are feeling are necessary to treat your lungs and reduce the amount of inflammation in the lungs, I think is beneficial. And taking those extra judicious precautionary steps and just understanding this time of sacrifice for all of us. We've all changed our lives. No one is enjoying managing life in this pandemic. I mean, this is a disaster, and we just have to. It's uprooted lives, it's cost lives, it's affecting lives. And my biggest advice is to please take your medications. Declare symptoms early to your physicians if they were to arise. Take this very seriously.
And Dr. Mo, this research is so interesting, and we talked about some very serious issues today. And I'm just wondering, what does this mean for like the average family in North Texas? Like, should it change or affect the way that we all are thinking about COVID-19 right now?
You know, I would probably ask the dean to make a comment on this, and I can follow up with any other comments. But Stuart, what are your thoughts in terms of how research at this stage could be meaningfully impactful to a community? I think that's something Stuart would really be able to articulate.
Well, I think I'm hoping some major discoveries come out of our working group, but I think lower than that, and this may not be addressing your question, Prescott, but what is going on in our community hopefully gives another portal of knowledge and science that's coming out from our region and from our county and from this research group and from others, not, you know, to state the obvious, at a UT Southwestern and Bumpsy over in Dallas. And what, from my point of view, we all know there are two diametrically opposed camps on addressing all of this. All we can do is what we believe and be principled in that, and then help in almost a subliminal way, not in a political way, inform our community. I'm not sure if that was your question, but I'm feeding off of how Mo distilled it.
Right.
And I think the only thing I'd probably add to that is, and we talked about this in our working group, if the nadir of our work together is that we brought a group of very diverse and exceptionally talented physician leaders and clinician scientists together to work on an important problem, and then have seen, as a result of this incredible infrastructured group that's capable of really tackling challenging questions in clinical medicine and science, that'd be great. If I thought that was the absolute nadir, I'd be thrilled. But the peak for us, really, I think for all of us, and I'd speak for all of us in the group, is that if we can save one life in our community, because our hypotheses were proven correct by science and by evidence, then we would really truly accomplish something that I think we can be proud of, and I think that our community could be proud of, because it was their physicians that went down this voluntary pathway.
And before we close out, I just want to let everyone know, if you just joined us, we're having a conversation about a COVID-19 research group that's been organized by the TCU and UNT School of Medicine. And just as a closing thought, for anyone who's just wondering who's susceptible to getting COVID-19 as we are trying to wear masks and social distance, Dr. Mo, can you just give us maybe a quick rundown of people who are most susceptible and just why it's important for them to wear masks, social distance, and for others to do it as well?
Yeah, I think, and that really does, in fact, encapsulate many of the earlier comments too. You know, I tell our patients, we've got a very busy practice here in Central Fort Worth, and what we tell every patient that we see is, golly, if I had some way of quickly scanning you with a thermometer, but actually that read your genetic code and then understood your response to a novel pathogen, and then was able to tell you, listen, it's very unlikely you'll develop the cytokine or bradykinin storm and you're going to get real sick. Wouldn't that be incredible? And I hope we'll be there eventually, you know, as a scientific and medical community. But in the absence of that, frankly, I think everyone should take great precautions because we can't predict which young person is going to get COVID and end up in our ICU on life support versus which young person is going to do just fine and potentially even asymptomatic. Likewise, we don't know what patient with chronic medical conditions is going to walk out of the hospital in good shape versus those that don't do well. Ultimately, the more medical conditions you have, the more chronically ill you may be as a patient, the more susceptible you are to having a challenging outcome. And that's partly based, if not entirely based, on concept that we call physiologic reserve. So the body only has so much bandwidth when it's working so hard to manage so many disease states, and you have various different drug therapies, device therapies to help a patient to be able to mount an effective, immune response. And so my biggest piece of advice is we want everyone to take this very seriously. We want everyone to commit to all the important concepts related to social distancing, wearing masks, taking precautions, making these important sacrifices in terms of all the things we take for granted, right? Our usual social lives. And then if you've got medical conditions, you need to probably, you need to double that vigilance and be that much more, mindful.
All right. Well, on that note, that will do it for today's FWMD live chat. I want to thank everyone on Facebook for being a part of today's live chat, and also special thanks to our guests, Dean Stuart Flynn and Dr. Sathya Murthy. We appreciate you taking the time out your busy days to chat with us about COVID-19 and your research group. I just want to make sure to let everyone know to join us next Thursday, October 8th at 1 p.m. And we will have Dr. Kareem Jamal, Dr. Joanna Luke, and Dr. Brian Dixon joining us. And we're going to have another conversation about COVID-19, but it's going to be an update just to hear what's going on in the emergency rooms and what we know so far about COVID-19 and what we've learned this year. So make sure you join us next Thursday, October 8th at 1 p.m. Once again, thank you everybody for watching, and we will see you next week.
Thank you.
Thanks.